Good afternoon, class. My name is Melissa Ernest, and this is my week 2 discussion on a patient that I will be completing a SOAP note on. This week I am going to focus my SOAP note on a psychiatric aspect. Fair warning before I start, because I feel one coming on. If I do cough during this, I do apologize. I do have a cold going on. I tried postponing this as long as possible to maybe sound better, but it's just not going to happen. So going back on to my patient. This last week we had a 47-year-old female Caucasian come into the clinic alone with chief complaints of she has a drinking disorder and she is worried about her health and her future at this time. So a recent medical history on her. She was recently admitted into the hospital with alcoholic pancreatitis. She spent 6 days there where she went through the withdrawals. She did not have seizures at that time, which is great because she does have a history of alcohol withdrawal seizures. But she was supposed to come into us within a week of being discharged, and she didn't come into us for over a month. During that month time span, she does admit that she did drink some during that time, but she did not partake in any drug use at that time. Her past medical history does include alcohol use disorder, drug use disorder, anxiety, PTSD, depression, and that seizures from alcohol withdrawal that I previously mentioned. The patient states when it comes to her drinking, she has been drinking since the age of 14. She was also using drugs at that time, and she was sexually active. She had her first child at age 16. However, she did have that child taken away from her in 1995. She did end up, she had her child taken away earlier in 1995, and she was heavily drinking, and she got her third DUI. She did do some time in jail for this, and at that time from 1995 to 1999, she did stay sober. However, in 1999, she did start drinking again. And in 2018 to 2020, she did remain sober again at that time. In 2020, however, she did lose her job, and due to life stressors and everything going on, she did start drinking again. When she went into the hospital this last month, she was reportedly drinking 2 bottles of wine a night, as well as multiple shots of vodka, and she did state that she does binge drink beyond this at least once every 2 weeks to once a month. We did bring in our behavioral health counselor into the office. We do have one in-house, so we did bring them in, and we kind of discussed all plans that we had available for her. At this time that she was in with us, she had not been drinking for about a week. She said she had gone through the withdrawal stages again. They were not as severe as before, but she did not want to relapse into drinking again. So we set up some behavioral health counseling plans with her. She's going to go weekly with our in-house specialist, as well as set her up with the STARS program, which is Samaritan Treatment and Recovery Services. It is a residential program as well as an outpatient program. At this time, she would like to remain outpatient so that she can try to start looking for a job as well. As far as medications go, we are starting her on acompressate, which is to help avoid alcohol. Naltrexone is generally the first-line treatment. However, because of her opioid use, and she can't say for certain that she is not going to use opioids, we don't want to start her on this medication. So we are starting her on acompressate. Prior to starting that, we are going to do some electrolyte studies, some renal studies. We need to verify that she is not pregnant at this time. So we are going to do a pregnancy test, and depending on her weight will depend on what dosage we provide her. At this time, we are going to provide her 666 milligrams per dose. She will take that orally 3 times a day. We're also going to restart her on Lexapro. She was on this prior. However, she hasn't taken it in the last 6 months or so. We are going to start her on 10 milligrams. She was educated on side effects of both medications. She was also we have her coming back in 2 weeks to determine whether or not she has been taking both medications, as well as if she has been successful in abstaining from alcohol during those 2 weeks. We also want to ensure that she is following up with the behavioral health specialist, as well as the STARS program, and how those are working for her. We want to provide her as much treatment as we can. If we determine that these are not going well for her, we can adjust the plan, we can adjust medications, and we can look at possibly a residential program if that's something that she needs. Unfortunately, one thing we cannot control for her is her living situation, her family situation, her friends' dynamic. So that is something that, while the behavioral health treatment can help her manage, it is not something we can manage 100%. So we do need to keep encouraging her to make healthy decisions, lifestyle changes, and just support her as much as we can. So that is my patient for this week. I look forward to hearing any ideas that you guys have for her, any resources that you guys can think of for her, things that maybe I should have said that we did do that I didn't mention just because my cold, foggy brain. But I do look forward to hearing all of it. Thank you guys, and have a great day.